First of all, can you disentangle why this case count is increasing? Is it just because of the increase in testing, or is there a genuine increase in people getting sick? Because it sounds like there's certainly been an uptick in people filling the hospitals.
Yes, and as you alluded to, it's definitely more than just testing because of a number of indicators. The increase in the percent of positive test results over a month ago, was about around 5%, and now in the last week it's been between 11 to 13%, depending on which one of the models you're looking at in terms of the case counts, how many tests come back positive. As you mentioned,
Yeah.
the hospitalization rate has gone up by 49%. ED visits have gone up. So all of these trends kind of come together to point to it being more than just testing, and really because of extensive community spread.
And you think that community spread is related to the reopening? So Arizona did have some version of a shutdown. It reopened, and you say that there just has not been mask wearing. And I can't help but think about Las Vegas right now, where the casinos are not requiring people to wear masks. I mean, if there's one thing that we've learned over the last couple of months, it's that so much of the spread of coronavirus can be prevented by wearing a mask. So tell us what you think has been going on in Arizona.
Absolutely. I think that's one of the key points is it's not a question of whether we should have reopened when we did or not. It's how we did in terms of the behavior of individuals. Obviously, the guidelines that we were referred to by the CDC are sound, but most folks have been out and about in closed spaces, including nightclubs, bars, malls, restaurants, without any mask wearing. And I think that's a big contributor to what's going on. And this idea that we can just kind of go back to normal prematurely has been a big issue. And as you mentioned, casinos or elsewhere, we know that masks do play a critical role in terms of preventing the spread. It's not only good for you as the individual wearing the mask, but it's good for all those around you. So it's really part of our civic duty to do the right thing by wearing a mask.
One other question, Dr. Shad, especially as we watch the market selling off today and people are concerned about these new waves. What would it take for Arizona to contain this one? You know, obviously, once the community spread starts, it's a little bit more difficult to stop. Nobody wants to see shutdowns again, obviously. So, you know, would it take some statewide measure about required mask wearing, something to that effect? I mean, what can keep this from filling up the hospitals more quickly and spreading more rapidly in the future?
Yeah, that's a great question. I think that the key point, short of having another lockdown, which actually did work well, the numbers did go down when we did have our version of our lockdown here in Arizona. Short of doing that, which, as you pointed out, would have negative implications for the economy as well as for mental health in terms of people being cooped up, I think the cost of staying open is for us to have more restrictions. And one of those restrictions I think that's going to be critical is mandatory mask wearing by all employees. From a public health perspective, that makes sense. And then really making it a very strong recommendation, if not a requirement, for folks going into closed settings, such as restaurants and other venues like that, to wear a mask. And then I think we have to reevaluate certain openings, maybe not everything, but perhaps we should reevaluate movie theaters because of the timing, because we know that it's not just about the being in close proximity with someone, but it's also the amount of time you're in close proximity with someone. So if someone has the infection and can spread it to you asymptomatically, the more time you're with them, the more chance you are of actually getting it, as well as transmitting it to others.